Шановні колеги,
Dear colleagues, dear friends, we are happy to welcome you on our 12th webinar and workshop on track to improve health of women living with HIV in Ukraine. Right, it's the 12th webinar. For 6 years, we've been holding our workshops. Number one was in 2019. All of them are organized by WAVE Group, Women Against Viruses in Europe, which is part of EAC's family. And we are very grateful to our colleagues from WAVE and EACS for this opportunity that in these difficult times for Ukraine, we feel your support and we can hold our important events to talk about issues of treatment, management of women living with HIV, and a couple of words about our today's workshop. So today is day one, and you know that tomorrow we also are working. Today we are going to talk about pre-exposure prophylaxis for women at risk of HIV, and tomorrow we are going to talk about breastfeeding and chest feeding of HIV-exposed babies. So in order to get the certificate, you will have to undergo survey at the end of the workshop. And it's not to assess the level of your knowledge, it's just to assess the quality of the workshop itself. What is really important is every one of you is our participant, and you can put your questions in our chat, and for sure we will do everything possible to give answers. If we don't have time for some questions, we will get them and send them over to our speakers, and we will discuss them at one of our next Friday meetings. So that's all for household issues, and at the very beginning I would like to introduce our co-chairs. So Caroline Abbey-Pop is with us today. You know her perfectly well, doctor of medicine, gynecologist, researcher, and first-class specialist on issues of HIV in women. She's working in the infectious disease department at Bern University Hospital, Switzerland. Also, Svetlana Antonyak is with us. She is infectious disease specialist, researcher at HIV, AIDS, and viral hepatitis Center at State Institute of Epidemiology, Infectious Diseases, named after Gromashevsky Academy of Medical Sciences, Ukraine. She is also an honorary doctor of Ukraine. She is from Kiev. So first of all, I would like to give the floor to our chairs for welcoming words. Caroline, I would like you to start, please.
Thank you very much, Sarati, for those nice words, and I welcome everybody who's participating in this 12th workshop. It's really amazing that we did those 6 years in collaboration. I especially would like to say that we want to improve access for women living with HIV, but today our topic will be prevention, which is also such an important topic, and I think we are working hard, but we like our educational workshops because they are just inspiring and motivating in those difficult times. And today I would especially like to thank Svetlana and Sergey, because Svetlana is not only leading a great hospital and clinic, but Svetlana is always also since 6 years leading our lively discussions. So the time seems always too short, because she has such an inspiring and motivating personality leading those discussions about clinical cases, about gaps in knowledge, about opportunities we have for the future. And I would like to thank you, Sergey, because you are the heart of those workshops, because you are always looking that we keep the time, that we have the programs ready, that we look for our participants, which interests they have. And this is really Sergey who's organizing and keeps us on track. So I wish you a very nice workshop. This is from my side a very warm welcome, this time from Ireland, and have a good time and especially good discussion.
Пані Світлано.
Дуже дякую, Керолайн.
Ms. Svetlana, yes, thank you so much, Caroline. Dear colleagues, I'm very happy to welcome you at our 12th Wave EX workshop on track to improve health of women living with HIV in Ukraine. And I would like to thank you from my whole heart for showing the interest and for finding time to participate. I also would like to express my greatest gratitude to Dr. Caroline Ebipop, Doctor of Medicine, Master of Sciences, who is working as a gynecologist researcher at the Department of Infectious Diseases University Hospital in Bern, Switzerland. And today she is the chair of our workshop. So are you talking from Ireland? You have mentioned. Is that right? Yes. So Caroline Ebipop has been participating very actively in developing and holding of a lot of trials and studies in HIV in women, together with the Swiss cohort study, European studies. She's been developing recommendations with regards to pregnancy and HIV, ways of deliveries, issues of prevention of transmission, HPV2 virus, and her research and interests are related to breastfeeding issues, menopausal issues in women with HIV. And it was actually Caroline who is back in 2019 when she was chair of WAVE, the head of WAVE. She inspired our workshops on track to improve health of women. That was done together with a professor of Warsaw Medical University, Justyna Kowalska, and Professor Fiona Malkahi, who was working in St. James Hospital in Dublin. And at that time, she was the vice president of European Clinical AIDS Society. In summer 2019, through the first workshop, WAVE EX workshop took place in Kiev, then it was in Lviv, and over those last 6 years, yes, it's the 12th workshop on track to improve health of women living with HIV in Ukraine, organized by the Secretariat of European Clinical AIDS Association and WAVE, and the interest of Ukrainian doctors towards EX WAVE workshop with a focus on the most important issues of health of women with HIV is high. During COVID and now during very difficult times for Ukrainians, war times, we still continue our activities in online format. And this is our sustainability, resilient stability, and that's something that we all need. And we are very grateful to speakers and participants from Europe for continuing to help Ukraine. We are grateful to you, dear European colleagues, Dr. Silvia Nozza from the Institute and San Rafael Clinic from Milano, Italy, and doctor from Ukraine, Tetiana Melnik, who is a postdoctorand at the Institute of Epidemiology and Public Health named after Pierre Louis in Sorbonne University, France. We are very grateful to Diana Shevchenko, infectious disease specialist, and she is working at the Management and HIV Response Center for Public Health, Ministry of Health, Ukraine. And also we are very grateful to representatives of NGOs, which is really important, not less important than doctors, Positive Women. It's a national network of women living with HIV, and it unites all activists, women activists from all over Ukraine, Natalia Kovnir and Olena Strazhak. Also, thank you very much to all participants of Ukraine, regardless of sleepless nights and air raid alarms and alerts. We still continue to work at this workshop, and we really understand and comprehend that it's important to consider issues of women and babies even today when we have a martial law in Ukraine. So we focus our attention on very important issues of pre-exposure prophylaxis and with an focus on women. Antonyak Serhiy is a moderator, a researcher at the Department of Viral Hepatitis HIV at the Institute of Epidemiology, named after Gromashevsky Academy of Medical Sciences, Ukraine, and he is also a member of Scientific Wave Committee. Of course, I have to say once again, thank you to all of you, and let us start our work. Thank you. Thank you, Caroline. Thank you, Ms. Svetlana. So, right now, let us have a look at our today's agenda. Today, we have planned 4 mini lectures. We start from a mini lecture, so overcoming gaps to access to pre-exposure prophylaxis for women, presented by Dr. Silvia Notza, Doctor of Medicine, specialist in infectious diseases, also professor and researcher at the Vita Salute University, Milano, Italy. Also, she is the head of the Department of Prevention and Treatment of HIV and STIs. Also, the head of the Department of Clinical Research in the area of infectious diseases, Scientific Institute San Raffaele in Milano, Italy. Silvia, thank you so much for joining us today. And after this lecture, Silvia's lecture, as usual, we will have a session of question and answers, discussions, and after that we will switch over to the second lecture, PrEP, French approach and perspective, from Tatiana Melnik, Ukrainian infectious disease specialist who started to work in HIV in Vinnytsia AIDS Center back in 2003, and since 2015 she was working at the chair of infectious diseases in Vinnytsia National University, named after Pirogov, and Tatiana is a postdoctorand of Institute of Epidemiology and Public Health of Pierre-Louis in Sorbonne University in Paris, France. And also Dr. Melnik is the head of management board in EACS, and we greet you, Tatiana, on that occasion. Then we will have a Q&A session and discussion. After that, we are going to have lecture number 3, so involving sex workers to gynecological services that are barrier-free and getting PrEP in Ukraine. It's going to be presented by Natalia Kovner. Since 2001, she's a manager of Positive Women charitable organization. She has a lot of experience working in NGOs, and since the large-scale invasion, Natalia continues to help women living with HIV under humanitarian aid projects and advocacy, and in charge of her team is 23 cities of Ukraine. Then another Q&A session and discussion, and then it's going to be the last but not least mini lecture for today, PrEP for HIV in Ukraine, presented by Diana Shevchenko, infectious disease specialist at the Department of HIV Response at Center for Public Health Ukraine, national coordinator for PrEP, HIV PrEP, and Diana is also into organization of implementing long-acting cabotegravir in Ukraine for PrEP. And Diana has experience working at viral hepatitis department, also was working with patients with COVID and other infections as well. And another very important participant to our today's meeting that is going to join us as a person to discuss and tomorrow to present is Olena Strazhak. Since 2016, she's the head of organization that is National Network of Women Living with HIV, and actually this is called Positive Women, uniting activists from all over Ukraine. Since 2023, Olena is part of the global WHO committee to validate elimination of HIV, syphilis, and viral hepatitis from mothers to babies. So it's a powerful team of speakers for today. So, if it's okay, let us switch over to our first lecture about overcoming gaps to access PrEP for women. Ms. Sylvia?
Good afternoon to everyone. Thank you to give me the opportunity to talk about this important issue for women and in general for population in Europe. These are my conflicts of interest. HIV remains a public challenge in Europe. In particular, in this slide, we can see the last data about last year of HIV infection across Europe. I want to underline that HIV infections are different in different countries of Europe, and this highlights the importance to address some prevention in some different preventions in different parts of Europe. In particular, regarding women, we can see that in total, heterosexual transmission in women represent about a third of HIV infection across Europe. In Ukraine, in particular, we estimate that the new HIV infection among women are about 4,000 and 5,000 in last year, and the distribution is different in different parts of Ukraine. In particular, in southern and the eastern regions, HIV infections incidence is higher. The main transmission routes is heterosexual intercourse, so again, sexual transmission and injecting drug use. Younger women are particularly susceptible to HIV infection and to all sexually transmitted infections. We know that in Africa, this key population from 15 to 24 years old is a key population, and again in Europe and in particular in Ukraine, these women are particularly vulnerable for anatomical reasons and for a higher inconceivable HIV transmission. We estimate that weekly until 100 of new HIV infections in females occurs in Ukraine. This slide is a slide of a paper published in Lancet HIV Infections, and that was showed in last CROI conference, that highlight the number needed to treat with PrEP to save an HIV infection. It's a quite difficult slide, but I can summarize with this word. If there is a population or a key population or a country in general where HIV incidence is more than 3%, we can save an HIV infection treating with PrEP 33 people. But if we have a population, a key population or a country with an HIV incidence less than 3%, we have to treat with PrEP more than 200 people to save an HIV infection. So this means that the investment for PrEP is higher in the country that have a lower incidence, but we need to treat more people in countries that have a higher incidence. PrEP in females is efficacy. This slide summarizes the key trials of PrEP in women, but the current available PrEP for women is only an oral PrEP that is a combination of TDF and FTC. We can see that trial showed that if there is an high adherence level of PrEP in women, the efficacy is higher. For example, in partner PrEP, the efficacy is 82% if women are adherent. But if the adherence is lower, for example, in FemPrEP and in voice studies, the efficacy of PrEP in women is less than 30%. Why people can be less adherent to PrEP? For fatigue to take pills every day. In fact, until the last guidelines, the regimen recommended in females is the daily regimen, but studies demonstrated that at least 4 pills in a week can protect females more than 90% to have HIV infections. In last WHO guidelines that are not yet published, the schedule that we can consider is on-demand schedule for women. In this moment, recommended on-demand schedule for women is a schedule that uses PrEP with a double dose for the first dose. The protection begins after 2 hours, and then females continue PrEP until 7 days, the last sexual activity. But now the current WHO guidelines that will be published in next month recommend the use of on-demand schedule for only 3 days after sexual intercourse. So these facilitate the on-demand PrEP for women. There is another oral PrEP available for men in this moment just in USA, that is the combination between TAF-FTC. TAF-FTC has demonstrated higher efficacy than TTF-FTC in men in Discover trial, but in Purpose 1 trial, you can see that TAF-FTC is efficacy also in women. So this could be a possible option in future for females if, of course, WHO guidelines recommend this. In this moment, it's not recommended in women, but in the future, it can be. TAF-FTC for women, we know that TAF has a lower concentration in vaginal tissues compared to rectal tissues, and that it is not yet approved for vaginal exposure. In general, when we propose PrEP, the acceptability of PrEP is lower than expected. This is a trial that my center published this year that underlined that if we offer PrEP to all people who have the characteristic to have PrEP, so for example, people with at least one sexual transmitted disease, not all, but just one part of them accept PrEP. In particular, we can see that for women has a screening for STD generally lower than men, but women accept PrEP just in 2% of cases, so in a minor population. What are the barriers to prescribe PrEP in women? First of all, the stigma. The females are fear of being labeled HIV positive or promiscuous for taking PrEP, the pill burden and the fatigue from daily dosing. In some part of the world, the taking pills every day is not so easy. The doubt about PrEP efficacy and of course, the unpleasant pill characteristic or the challenges for routine. The other barriers are interpersonal and community, in particular parental influence. For example, for young women that live with the rest of family, you can think that there is a lack of privacy. The negative peer pressure, the cultural taboos, the myths, and the perception. For these reasons, there are other options that are approved for females that are long-acting options. The first approved long-acting option for females is dapivirine vaginal ring. In trial, this option demonstrated up to 56% of efficacy, in particular in women aged more than 21, because again, young women are less adherent. So WHO recommended this option as a possible option in this setting, so females with more than 25 years old. But the efficacy, of course, is related to adherence again. So if females doesn't change the dapivirine ring, the adherence and the probability of acquisition of HIV infection is higher than the perfect adherent. And for this reason, in last years, we had many trials about long-acting PrEP. Now there is just an approved long-acting PrEP for cisgender women, that is cabotegravir. Cabotegravir, that is an injectable PrEP just used in treating HIV infection, so in people living with HIV, that demonstrated zero infection in women that took cabotegravir every 2 months. The first dose is after 1 month, and then every 2 months, that are adherent to this injectable schedule. The other drug that is under approval of FDA, we expected approval on 16th of June, is lenacapavir. Lenacapavir is a more interesting drug for schedule. We observe again zero infection in people who are adherent to schedule, but the schedule is a schedule easier because it's just one injection every 6 months. So we expect people can choose the best treatment for PrEP. In these studies called search study, we observe that if a woman or in general a person can choose a treatment that fit with their characteristics, the adherence is higher. So I can choose cabotegravir long-acting or oral PrEP, and I can follow the schedule, but I'm happier because I can choose my treatment. So the key points about the women PrEP, and in particular the gaps about PrEP prescription in women, are the addressing multi-level barriers is essential to improve PrEP. So speak to women about the possibility to prevent HIV infection with PrEP. We can offer injectable or implant PrEP alternatives. Now we have available dapivirine ring, and in some countries, not in Europe, unfortunately, just in some countries of Europe, the cabotegravir, and we hope that we will have available also lenacapavir. We have to provide a choice, because a choice can increase adherence. So if I can choose oral PrEP or injectable PrEP, I am more adherent. I have to ensure free and local access. The community is essential, because we have not to judge people in general, in particular young women that are more frail to take PrEP, and we have to ensure friendly services. So PrEP is for women. I recommend the prescription to PrEP, in particular in key populations, so in younger women, and thank you for your attention.
Thank you so much, Silvia, for that wonderful talk. It gave us really a great overview about not only about the options, but also about barriers. And you mentioned really well that it might be helpful if women can choose, especially for their situation in life. I was wondering when you talked about the ring, because as a contraceptive, for example, in Switzerland, the ring works really well. And it would be great if, because this is not seen by the others, women can control the application. And what is your personal opinion about the best choice? Or do you also think it depends on the individuals and especially on the setting? Because you're an expert. That was my question.
Yes. In Italy, we have available just TDF-FTC, but the option of on-demand PrEP in women now is very good, because we are enlarging our population. For example, we have not available dapivirine ring, but I think that dapivirine is not well known by the population. And finally, of course, we hope to have cabotegravir and lenacapavir, but for the situation in Italy, I think that cabotegravir could be available in next month, but lenacapavir no, not again. But in terms of epidemiology control, they are both very, very good.
Thank you. Are there any other questions from all our discussants?
Здається, що є. Дуже дякую всім.
I think so, right. I'm just looking at our chat, and I would like to say that almost 150 participants are watching us, which is very good. And we do have a question to Dr. Notza. Sylvia, what do you think about recommendations to do screening for viral hepatitis B and assessment of GFR not before PrEP, but during months from the start, since the start of PrEP. So do we have to prescribe PrEP that quickly?
Yes. I think that we must prescribe PrEP. In Italy, there is the availability of free hepatitis B vaccination, so we recommend it. But if we need to prescribe PrEP, you prescribe PrEP also in the absence of vaccination. And about eGFR, we prescribe PrEP until 60 of value of GFR, and we strictly monitor the GFR, but it is not a problem for us because it is a problem not to start PrEP quickly if the patient need it.
One question, Sylvia, the young women you mentioned, how do you find or eligible women who do agree to take PrEP? How do you make it well known in the population? What is your plan? Because we find that really difficult. You have to work either with gynecologists or with clinics, or actually they don't see a doctor because they are young and healthy. So how is this option to take PrEP in Italy? How do you spread this message?
We spread with the collaboration of some females community. So in strict connection with the gynecologist, for example, but I totally agree we don't reach this population. So there is many work to do, too much work to do. I completely agree, and it is impossible without community in my mind.
Дякую, Сильвія. У нас є
Thank you, Sylvia. We have one more question from our chat. Sylvia, what do you think about the perspective to prescribe PrEP 2+1+1 in women regimen?
So the on-demand PrEP, yes. Recently, WHO guidelines permit 2-1-1-1. So not 1-1, but after 3 days. And I totally agree with this schedule. Is easier, and it is efficacious. So it is again a way to engage females to PrEP, because the all-day PrEP could be a barrier, in particular if they get sex every 2 weeks or every 1 month, I think.
Дякую. Дякую, Сильвія.
Thank you, Sylvia.
Так, ми
All
майже
right.
ідеально вкладаємося в наші таймінги. У нас є ще одне
We are almost on time, but we have another question. And maybe after that last question, we will switch over to our second lecture. Why transgender individuals getting exogenic hormones based on estradiol are not recommended PrEP on demand, considering the fact that on the Liverpool University website there is no data with regards to drug-to-drug interactions between estradiol and TDF-FTC. So that is a question from our colleagues. Thank you.
Sometimes guidelines are very restrictive, so I think that in this case, if a transgender needs on-demand PrEP, we can prescribe regarding the drug-drug interaction. So we have just to balance the guidelines and the real life, of course.
Супер, дуже вам дякую.
Super, wonderful. Thank you so much. Dear colleagues, do you have questions? Sylvia, I would like to thank you. And just to say, it's really very important to us, because from standard to standard, we are writing that women are not indicated on demand, the transgender individuals on demand also not indicated. But if women do not perceive and accept PrEP too good, so to say, it's time to understand that some of those barriers are too much barriers. So your opinion was valuable to us. Thank you so much again.
Thank you.
All right, dear colleagues, we are moving on. We are switching over to our second mini lecture, and this is about PrEP, French approach and perspective. Dr. Tetiana Melnik is going to present. Thank you.
Good afternoon. My name is Tetiana Melnik, and to your attention, I'm going to present some information about PrEP in France, approaches and perspectives. I have no conflict of interest. This is the discussion plan that I suggest for today. This is epidemiological data, new guidelines, EX guidelines and French guidelines approved in November 24. Trends and conclusions. What were the phases for PrEP development in France? So the first prescriptions that were temporarily allowed happened in 2015, and then validated, approved and authorized with regards to PrEP initiation and renewal started in 2016, and since 2016. So the first prescription, primary prescription, had to take place in a hospital or so-called CGID, Free Information Screening and Diagnosis Center for Sexually Transmitted Diseases, and renewals could be done by other doctors, for example, general practitioners. And then since 2021, all other physicians, including general practitioners, could even initiate prescription, give the primary prescription. And in November 24, injectable cabotegravir started to be used, but not as the first line, but second line drug for PrEP, in particular for people who have contraindications to oral use, to tenofovir, emtricitabine as PrEP. And this slide shows information about new positive cases, HIV cases in France since 12 till 2023. And among them, as we can see, the major routes of transmission is heterosexual women born abroad, MSM born abroad, and heterosexual men also born abroad, not in France. But what actually leads to this picture is given and presented on this slide. In particular, those estimated data. This is incidence HIV incidents that could be identified or not identified, but among them, we can see not only those categories that we mentioned before, but the heterosexual men and women born both in France and abroad. And number one here, of course, it's going to be heterosexual men, although it might seem strange, heterosexual men born in France and also MSM born in France. And the next slide also shows us women born abroad, and on the left part in red, we can see new cases, HIV cases that were identified, diagnosed among women born abroad in France. And on the right, we can see cases of infection. They might be identified, non-identified, but we can see that infection cases. Here is something that we can see in France as well. And also we see them among women born abroad, and contaminations, infections happened, but they do not know about their HIV status. And among those women, we can see those constitute the biggest portion. And this slide shows information with regards to prescription of PrEP on a monthly basis, and in general, if we talk about years 23-24, on average 1,540 people initiate PrEP each month, and overall, if we talk about new initiations, it was 100,400 people in 2016, and this slide shows information. On the left, we can see some information with regards to percentages of people who have initiated PrEP for the first time. This is in lighter color, and also in darker color, we can see the proportion of those people who renewed their prescriptions. And most part are those who renew PrEP. And on the right, this is information about those who just initiated. They started it for the first time, and the proportion of women here is very small but growing. And in the last part of 24, so we can see that 5.7% are women who have initiated PrEP. And here we can see a small study results that was presented at Sexual Health Days in May this year. The results were presented, and the biggest reason why people stop PrEP is changes in sexual behavior, 55%. The next one is desire to stop PrEP due to such reasons like condoms, for example, condom use. And the next one are medical reasons, like, for example, drug-to-drug interaction, side effects, so on and so forth. How trends change with regards to prescriptions since 2021, when PrEP could be initiated by any healthcare specialist at any healthcare facility. So we can see increase in initiation and renewals done by GPs, family doctors, and other healthcare doctors. And we can see smaller percentages prescribed, initiated, or renewed in CGIDS hospital, but the proportion is 50-50. And those are EX guidelines. So we had them in 23. Now we have a new version 24. Also, it's going to be a new version updated 25 presented in Paris on a conference. But the key difference here is compared to 23. PrEP is recommended in HIV-negative heterosexual women. And with regards to drugs that are recommended to be used, tenofovir, disoproxil fumarate with emtricitabine, is recommended by to transgender and cisgender women and men. With regards to TAF with emtricitabine, it's recommended only to men and transgender women. Cabotegravir can be considered available for transgender women, for cisgender women, and men. So these are recommendations that were updated in November 24 in France. It's a group of big recommendations, including HIV, hepatitis, viral hepatitis, STIs. And speaking about the HIV management section, there is a subsection talking about PrEP to prevent HIV. So these are indications for PrEP. Number one, of course, those are men having sex with men who have risks with regards to HIV infection. And number two is heterosexual women and men, and including, first of all, those are women or men with partners from highly endemic areas like sub-Saharan regions, for example, or others. Those who have sex either with HIV-infected people with uncontrolled viral load or unknown viral load. And also this pertains to those people who already had cases of PrEP use, post-exposure prophylaxis use, once or more times. So they are viewed as people with high HIV risk. So it's recommended to them. And also people who have sex with injecting drug users, because they might have a high risk of HIV as well. With regards to contraindications to PrEP, number one here is HIV testing. So if a person has not been tested and we do not have the results, the French guideline says we cannot prescribe PrEP, so it should be done 15 days prior to possible prescription. Of course, it should not be prescribed with a positive HIV serology. And with regards to information about people with hypersensitivity to ingredients or maybe GFR less than 50 milliliters. In this case, it's recommended to use injectable drugs like cabotegravir, long action. And this is initial laboratory assessment. It includes HIV serology, fourth-generation test, combined tests, and in case of any doubt, it's recommended to use viral load. And also, it's recommended in case injectable drugs are used, like cabotegravir, long action. Also, viral load testing is recommended. Also, GFR test, ALT, and we do screening for viral hepatitis and sexually transmitted infections. Also, the pregnancy test has to be done. So the dosing, it's either daily dosing on a regular basis and two approaches. So 7 days before first unprotected contact, and the second approach, so the first 2 pills are taken, but it's only for anal sex. And approach 2 is event-based dosing, 2 pills, and then in 24 hours, then 1 and 1. But again, this is about those men having sex with men and transgender persons. If we are talking about event-based approach, 2 to 7, like 2 pills, Truvada, and then after a sexual exposure, 7 more pills, 1 pill daily for 7 days. So this approach is not yet used widely. In particular, it was discussed during those sexual health days in France, but this approach is not widely used yet. In particular, in the guideline, it's not paid too much attention to, so it's not mentioned. And long-acting cabotegravir is used month 0, after 1 month, and then after 2 months, depending for how long a person is going to take PrEP. And this is the HPTN 084 study. This is the main study and that formed the basis for inclusion of this long-acting cabotegravir into the guidelines, and it showed very good results, and it allowed to use it in French. The only drawback is high cost, and as long as PrEP is supposed to be free of charge in France, it has to be provided free of charge. So this thing, this characteristic, so to say, is now probably making this drug is not the priority. And this is lenacapavir, long use, subcutaneous twice a year. It's used twice a year. And the study, the trial with regards to women, Purpose 1 trial, that trial was really efficient with very good results. Right now in France, the Purpose 5 trial is ongoing, but it's not about cisgender women, it's only transgender men, non-binary persons. No results yet, so the patients are still being included into that trial. And also a very important thing, the phase 1 trial looking at pharmacokinetics and safety of once yearly lenacapavir intramuscular, and it showed good results, good tolerability. And this is the trial that could be continued in next phases as well. So, in conclusion, PrEP is available and free of charge in France. It could be prescribed by any healthcare specialist at any healthcare facility. And please pay attention, if you have some patients residing in France now, they can come to the facility, healthcare facility, to be initiated or renewed on PrEP. So any doctor can be approached, a GP, infectious disease specialist, or other. And with regards to people who are on PrEP, as of 2024, those were about 60,000 people in France. And also PrEP demonstrated its efficacy in clinical trials in real life. And there are a lot of things with regards to covering migrant women with PrEP and the women who are high risk of HIV infection, how to involve them, how to cover them. It's probably a relevant issue for any country. And if we're talking about new drugs, prolonged action, so the door is open, cabotegravir is already authorized, approved to be used, and lenacapavir is used in clinical trials. Thank you very much. And just to give a brief announcement, EAX is offering membership. It's free of charge for Ukrainians, and it was provided for 1 year already, but it's going to be renewed, and all the information is on the EAX website. And being a representative of EAX governing board, I would like to, and this is for Eastern European region. So once again, I would like to invite you to our projects and events. One of the projects that's going to be presented in France at a conference, it's a project Dreams of Children Living with HIV in Ukraine During the Full-Scale War. This is to provide information to the community, to tell again and again about problems of our children, issues of our children, to show their creativity. So this information is also on the website, also going to be sent individually. Thank you very much. All the best to you.
Dear Tatiana, let me thank you very much for your wonderful presentation. Thank you for preparing this presentation in short notice. And it's very pleasant to realize, to understand that a doctor who used to work in Vinnytsia AIDS Center is now working in France, and you are postdoctoral fellow, as far as I know, at the Institute of Epidemiology and the Public Health of Pierre Louis in Sorbonne University. We are really very thankful to you. And I would like to ask you the following question. It's again, it was a wonderful presentation. Do you think is integration of PrEP service, pre-exposure prophylaxis, does it influence involving more women into this type of prevention or prophylaxis? We've heard already that women do not accept too much, are not very active in accepting pre-exposure prophylaxis. But how about family doctors? What is their acceptance or non-acceptance with regards to prescribing PrEP in France? And maybe you might mention a little bit how do you become family doctor in France, if it's okay with you? Okay, yes, absolutely. Good afternoon again. Thank you for this opportunity again to present and to answer your questions. Just as I have mentioned, yes, doctors started to prescribe PrEP starting 2021. Before that, there were a couple of surveys just for us to understand whether doctors accept that or they don't. So we understood that awareness raising is necessary, presenting information, because yes, doctors are not quite sure with regards to efficacy, side effects, just like in all other countries, and to explain it better. So the information and awareness raising campaigns were conducted to provide better instruments to doctors to involve women. And with regards to women, I would like to say, especially who are migrants, who just came from other countries, it's really important to them to be in contact with family doctors. It's much more simple and easier rather than going to CGIT, to that special center, because it's more confidential. And there is such an approach when a doctor, during conversation, interview, talking about contraceptive plans, reproductive plans, might ask a couple of personal questions with regards to sexuality, sexual relationships, and thus identify this possible need with regards to PrEP. So any doctor can prescribe and prescribe tests for initial assessment and subsequent assessment on PrEP. And of course, it's really important to include the information campaign, informing community, providing information, involving non-governmental organizations working with women, migrants, or women in crisis. Thus, it is done this way. So for that, and on the way to that, there are certain barriers with regards to those new protocols that we have. We have less barriers, so doctors have more opportunity to prescribe, prescribe testing as well, not just treatment. And there are some issues with regards to involving minors, and this is those who are not like minor age, young girls, for example. Sometimes they cannot do that without getting permission from their parents. So these are the barriers that are currently discussed. With regards to a family doctor in France, how do you become a family doctor? 6 years of university, just like in Ukraine, then internship for 3 years, that's mandatory, and at the end of that study, you have to write so-called thesis. It's not thesis per se, it's just research work where a doctor chooses the topic and then also he or she has to kind of defend this work before in front of a committee. And there are also other sorts of training cycles in pediatrics, OBGYN, that allow to get additional knowledge with regards to women as well. So that is why doctors accept such programs better. Thank you.
Дуже дякуємо, пані Тетяно.
Thank you so much, Ms. Tetiana. Dear speakers, do you have questions to Ms. Tetiana?
Діано, прошу.
Diana, you're most welcome. Dear Ms. Tetiana, thank you really very much for this wonderful presentation. Yeah, I value your experience and your work. My question, so in order to get PrEP, is it mandatory that a person has to be a citizen of France, a French citizen, or people who was dislocated from other countries can get that? Like, for example, our Ukrainian citizens, can they get these services? Thank you. Thank you, Ms. Diana, for your question. It's really relevant. I would like to focus your attention on the following. Any person, even without like ID, official ID, giving it, for example, giving them the opportunity to live in France, they can get PrEP, including Ukrainians. If a person does not have a social insurance yet, and if a person does not have a permit for residential permit, that person needs to go to so-called CEGIT. CEGIT is the center at the university clinic or somewhere else where there is an infectious disease department, or at least where the testing for viral hepatitis, HIV, STIs are done, so a person can get their national document ID from their country of origin and undergo testing there. So the mechanism is in place, and the hospital will provide the drugs and will do the renewals until a person will get official documents. So when a person gets the official documents and IDs, then that person can go to any specialist, not just the CEGIT. Thank you so much. All right, thank you, dear colleagues. Okay, so I'm a timekeeper. We are almost ideal in following our timeline. What I suggest? Yes, now I think we need to switch over to our third mini lecture for today, involving sex workers to get gynecology service data-free barrier and to get PrEP in Ukraine. Natalia Kovnir.
Greetings, my name is Natalia Kovnir, and I am a project manager of a charitable organization, Positive Women, and my today's presentation is going to be involving female sex workers to get barrier-free gynecology officer services and services of HIV pre-exposure prophylaxis. And I'm going to talk about that from the very beginning. Since the 1st of March 2024, we have started to implement a project together with the UN project UNFPA with regards to establishing and expanding offices of social and psychological case management with healthcare facilities. And we are talking about those healthcare facilities where UNFPA have established, equipped, opened barrier-free gynecology offices to provide gynecology and other services. First of all, before those gynecology offices were opened, healthcare workers were trained how to work with vulnerable women from vulnerable groups and what to do in crisis situations in cases of rape. So there was a series of trainings that were provided to healthcare workers. And then UNFPA have approached us, Organization Positive Workers, in order to strengthen work and the services of those gynecology offices and to make it easier for healthcare workers. We have strengthened the services with help of our case managers. So social workers from our organization, charitable organization, Positive Women, also were working at those healthcare facilities where those gynecological offices were established in order to help women to refer them, for example, to see a gynecologist for examination or to provide follow-up case management, or if a woman comes to a gynecologist on her own, a gynecologist might also refer that woman to a case manager for social case management, for counseling and other services to support that woman to provide her case management further. And the overall goal of the project is to enhance women getting healthcare services by case management referral with help of those gynecology barrier-free gynecology offices. And the geography of the project have covered those regions that are really closer to battlefield: Dnipro, Zaporizhzhia, Poltava, Odessa, Mykolaiv, Kramatorsk, Kharkiv, Kherson, Sumy, Chernihiv, and Kryvyi Rih. So the last 3 regions were added since this year, 2025. In each of those regions, teams were and are working, including a coordinator, a leader from a charitable organization, Positive Women. Those are those coordinators working in other projects. They were also involved in this project. Also, case managers were involved. Those are social workers that are from vulnerable groups of women, and at the end of 24 and the first quarter of 2025, we also have involved outreach workers to our project. And with healthcare facilities, social psychological support offices were established, and I've mentioned those a bit earlier, and that's where the case managers provided a range of services to vulnerable women living with HIV, internally displaced women, sex workers, and women who were survivors of gender-based violence. So those were the key groups that we worked with in our multidisciplinary teams. And at the end of 2024, starting from November 24, we have started a pilot project to work with sex workers. So we have involved 18 outreach workers to our project out of the community of sex workers. And that was done in order to support those women who were in need of gynecological examination and case management and support to involve them in PrEP. So as I have mentioned, we had 18 outreach workers. Chernihiv, Sumy, and Kryvyi Rih were added, as I've mentioned, out of the regions. And what was the task of the outreach workers? According to our information that we have gathered from case managers who were working with women before November 24, the majority of sex workers are going out to work. So in other words, they are going very close to battlefield to provide their services, and it was really difficult to find those women because they're very close to battlefield and to the front line. But outreach workers, they had contacts and they could contact those women and find them, and they talked to them, counseled them, motivated them in order for that sex worker getting timely gynecological examination services. And after counseling this woman, for example, this woman was supported and accompanied to come to the gynecological office to get pre-exposure prevention. With regards to places where a woman might get PrEP, our coordinators have agreed to talk to, and actually they had agreements with 8 centers and also TB clinics who had PrEP. And an infectious disease specialist who used to do the case management and is continuing the case management for those women to get PrEP, received necessary medications for PrEP, and over the 6 months of this component implementation, we were able to get very good results. More than 200 women talked the outreach workers, this is the unique women, to get counseling, case management. With regards to the referrals to barrier-free gynecology offices, the number was 700. That's actually a huge number for such a small pilot project. Number of HIV tested women in this project was 166. Number of women referred to get pre-exposure prophylaxis is 101, but not all of them actually physically came, because after counseling and case managing sex workers sometimes they have myths that PrEP might have some side effects, and that's why it's not necessary to take it. That's what we heard from some of the sex workers, and they used to say, I'm using other methods to protect myself. So that's were the myths, but the outreach workers, they still try to motivate the women to get PrEP. And as of today, there are 75 sex workers who actually received PrEP, and now they are managed and followed up by infectious disease specialists, and they continue to give them medications, PrEP medications. And in the end, what I would like to mention with regards to this component implementation is as follows. Services to counsel and to follow up and case manage are quite efficient and timely. And at the end of the first quarter, after the project was suspended, the majority of sex workers and women from vulnerable groups still continue to call and approach our case managers, outreach workers for consultations with regards to getting the gynecology examination services. And also the majority of women who would like to get PrEP, it cannot do that now as long as this project was suspended. And considering high efficacy of this intervention, it should be continued, and additional resources are required for that. Thank you for your attention.
Thank you very much, Natalia. I am very impressed by the power and implementation, and that you did this during those difficult times, and the outreach, the way of outreaching to very particular population in need. And I would like to ask you, so this was very successful. What do you think? What you have learned in terms of do you need also to link, as you said, to healthcare settings like gynecologists and infectious disease places? Because when you give those women PrEP, they need somebody to look after the laboratory or the follow-ups. Do you find that easy, or I think this is key, isn't it?
Thank you for this question. In fact, it's not easy to do at all, because women that we were working with, they are actually outside the territory of those oblast centers where gynecologists usually are present. And as a rule, it is quite difficult for women to physically get to the gynecology offices. And thanks to implementation of this project, we had some opportunity to pay for transportation, and it was kind of a motivation for a woman to be able to travel from far away, from a remote place, to come to the gynecology office where a friendly gynecologist would provide the full scope of services. And also another motivation that we used was humanitarian aid. We were giving them so-called hygiene packages. And the majority of women didn't have a possibility to buy even the most easy and simple things, so we did that. It was difficult, but we did it. And how about the pre-exposure? Yes. So what kind of doctors were providing PrEP? Infectious disease specialists. Yes, infectious disease specialists provided PrEP because there was preliminary agreement with them. So at regional healthcare facilities, that's right, at regional healthcare facilities covered by the project. Thank you, Ms. Natalia. Thank you so much. Ms. Olena, we would like to hear your comments as well. Yes, thank you so much. First, I would like to thank Svetlana. Thank you very much for inviting me, not just me personally, but our organization, whole organization, because it was mentioned before and it was mentioned by Ms. Tatiana. And also I heard experience from other countries. And in the beginning, yes, we heard about that. I'm very thankful to doctors, to medical community. Thank you for valuing our support, valuing our help, because we are in partnership. Only in partnership we can achieve success. And it was mentioned, when community is involved into providing services, we can see the efficacy of service provision increases manifold. And one thing is to involve someone for PrEP, for treatment, any healthcare services, but a totally different thing, which is even more important, is retaining, keeping a person, to do a case management, to do follow-up, to tell a woman about side effects of ARVs, how to prevent, how to live with them, like what to do with them, because what we faced, we saw a very high level of concern on part of women. What's going to happen, whether those ARVs or other drugs are harmful, okay? So they have a lot of concerns. So when we do it all together, it's much better. And we are not prescribing, we are not giving out the medications, but we are working as a team. And working as a team is the only way to get to success. And as Natalia has mentioned, it's quite high figures that we are presenting. of course, compared to France, and I'm very happy that I heard information from France, you know that a lot of women had to go outside of Ukraine in the beginning of war. And in France, we have a lot of Ukrainian women who also might be participants to that program, and I think they are already. And we also have keep in touch with women who came back, and our women already are activists in other European countries, and through them we can spread this information as well. So when I heard figures from France, they are impressive. For us, it's our goal, because this is free of charge provision of prescriptions. But the amount that we can provide in Ukraine as well is not as much due to problems of funding. And you know that there is a critical situation with funding from the USA. It also impacted all other donors, including European donors. So regardless of the fact that the funding for our project is suspended, yes, but we still continue to provide the services we can and to do the case management as well. And what we do, I believe we do the right thing, and we are happy to cooperate in future and be involved in order to organize this multidisciplinary follow-up. Thank you.
Дякую, Олена.
Thank you, Olena. For sure, we are working together. That's true, together with NGOs. For us, it is important. It's not only treatment, but follow-up, case management is important. We don't always have the resource for that. Svetlana, I just wanted to add, you do not just involve us, but you hear us. Okay, so you value our opinion. We are partners. That's true. We honor you. We respect you. Of course, we have to hear and listen to the community and hear the community. Yes, thank you for that. And thank you very much, Olena. Thank you very much, Natalia. Sergey, do we have more questions? Because you are the timekeeper, but maybe if there are questions, we have a couple of questions in our chat. That's true. For example, how did you select the outreach workers to do this pilot part of your program to work with sex workers? We chose outreach workers from the community. Unfortunately, we don't have any healthcare workers among our outreach workers. Those are either social workers who do the follow-up, or it's just out of sex workers, outreach workers who are out of the community of sex workers. So what we were thinking about that the counseling is going to be on a peer-based, going to be peer-to-peer based for a woman to be able to trust, to hear, to listen to that peer counselor and be safe. So that was the basis for our choice.
Дуже дякую.
Thank you very much. And actually, we have a comment. Thank you very much. A powerful presentation, very much needed project. A lot of women received services. And another question: how important is a sex workers component to maintain them, to retain them on PrEP? As Lena has mentioned already, and I mentioned that it is really an important component, because based on our experience, the majority of women who are IDPs, internally displaced, for example, in order to provide for themselves and for their families, relatives, to get money, in fact, yes, they started to do sex work. And another big issue, big problem with regards to providing such services is violence. So among women, we see a lot of signs of violence. We also co-work and communicate with lawyers. And we do referrals for a woman to be able to get the full range of different services, like legal services as well, if she needs that. So it is true, it is really important. And based on the feedback from our clients, we really understand that we do everything right. Thank you. Thank you, Ms. Natalia. Ms. Olena, maybe a short comment from you? I would like to add that in Ukraine, we have a powerful network of sex workers in Ukraine. So we do this work in parallel and in partnership with them. Important thing. Also, when we have any issues with drugs, their side effects, so on and so forth. So an important factor that us, community of women living with HIV, we have experience taking ARVs. We know everything about ARV drugs. We know about their side effects. So we share that. And this experience is valuable, I believe. Thank you. All right, dear colleagues, we are moving on to our next mini lecture, pre-exposure prophylaxis in Ukraine. Diana Shevchenko is going to present. Thank you.
Good afternoon, dear participants to the conference. My name is Diana Shevchenko, and I'm an infectious diseases doctor, Department of HIV Management and Response, State Enterprise Center for Public Health, Ukraine, MOH, Ukraine, Kiev, Ukraine. Today we're talking about HIV pre-exposure prophylaxis in Ukraine. No conflict of interest. First that we are going to talk is the system of PrEP services provision in Ukraine. So in Ukraine, primary healthcare facilities, secondary and tertiary level care facilities are involved into provision of this type of services. Also privately owned facilities and penitentiary facilities are involved to provide these services. With regards to coordination and monitoring, so these issues are covered by Ministry of Health Ukraine, Center for Public Health, and the National Health Service of Ukraine. So they are into monitoring and coordination of PrEP services. PrEP is also included into the healthcare benefits package. So facilities have agreements with NHSU and they contract for benefit packages, and PrEP services are provided according to that. So PrEP services and medications are free of charge to the client. Also, non-governmental organizations are involved into provision of PrEP services. They do counseling, referring to get PrEP. They do case management. Also, they involve healthcare workers to provide PrEP-related services at NGOs basis. Maybe a little more in detail that I would like to talk about legislative framework with regards to provision of PrEP services in Ukraine. First of all, PrEP is part of the National HIV/AIDS Response Strategy. So this is about HIV/AIDS, viral hepatitis, tuberculosis, to response strategy up to 2030. So here actually services have to be provided according to that strategy. Also, the operational plan was approved in 24 to implement national strategy for 24-26, and the goals with regards to PrEP also are written there for those 3 years, 24, 25, 26. There is a law of Ukraine about countering spread of HIV-related diseases, and there are state guarantees in the field of countering spread of HIV-related diseases with regards to prevention. It says that PrEP is provided free of charge in Ukraine. And with regards to National Health Service of Ukraine, I've mentioned that service. And in Ukraine, the system is as follows. The facilities, healthcare facilities contract and sign agreement with NHSU, and they pay for those services. And PrEP is part of the medical guarantees package or benefits package, and our clients can get them free of charge. And the facilities are getting money from NHSU for provision of that. Also, there are standards of healthcare provision under HIV infection, and the standards are updated on a regular basis based on international guidelines and standards as well. So, and as long as we are talking about improving health of women, improving the quality of their lives, so here I would like to talk about healthcare standard prevention of mother-to-child transmission of HIV. And there are certain items about pre-exposure prevention there. So one of the items is about detailed information about PrEP in general for women with high risk of being infected via sexual route of transmission. Also, in the standard, it says with regards to a PrEP provision for women among serodiscordant couples, and also PrEP for PMTCT. So if a woman is of reproductive age or pregnant or breastfeeding and has a high risk of being infected sexually or parenterally, or if a woman is already pregnant, she got pregnant, she can get PrEP. So information is there and services are provided. And also PrEP is allowed to be used together with hormonal contraceptives, and that combined use is quite safe, and it was proven. In general, with regards to PrEP services in Ukraine, a little bit of information about changes to PrEP program in Ukraine in 24. The network has been expanded. More than 200 facilities provide PrEP services. Counseling was included into the package of services as part of the HIV program. So separate item, PrEP counseling was included there. PrEP services were mapped, and also as I mentioned, the operational plan has goals reinforced, trainings were provided to healthcare workers, and also the algorithm of HIV testing for clients on PrEP was improved. In Ukraine in 2024, the combined test started to be used for HIV-1-2, antigen P24 for clients who are getting PrEP services. Also in 24, it was started to implement cabotegravir injectable and long action. With regards to mapping of services, there is an interactive map of HIV services shown here with regards to HIV-related services. So people can go up to the website of Center for Public Health. They look at what kind of services are provided. HIV-related services, find a facility that is comfortable for them and where they can go to get PrEP. So with regards to our results, with regards to implemented PrEP in Ukraine, 24, you can see how many clients receive PrEP, and among all of those 13,762, 125 have received long-action PrEP. With regards to clients coming back for repeat visits, you can see more than 1,500 clients were involved each quarter, and the last quarter, 5,000 more clients came back to receive pre-exposure prevention services with regards to involvement of different new clients. And here you can see how new clients are involved in those 4 quarters, so 2024, and the majority are discordant couples, people with risky behaviors. And here you can see with dark blue, also there is men having sex with men shown here. This is the second largest group out of the groups that are involved in PrEP services, and very little portion are women who provide sex services. And in the first quarter, 30 women of this kind were involved, 58, 35, and 65 respectively. So we really need a lot to work on in order for those services to be available for the clients to be informed about the availability of such services. If we look at the breakdown by age and by sex, so we see more clients who are men. If we're talking about age, among new clients, the largest group is 35, 39 years of age. And in general, if we look at how a PrEP client looks in 2024, so the biggest group is men having sex with men. And so those are men. So it's worthwhile to work more with women with regards to their access to PrEP. And you can see the age group 25-49. So, and of course, pharmaceutical companies are pivotal to PrEP distribution, and we publish and show relevant information at different websites, Center for Public Health and others. So together with NGOs, we have our mutual publications, and we also provide merchandise with a logo saying PrEP in order for people to be able to spread this information even more. And the summary: women in Ukraine need expanded access to services of HIV PrEP. Access of women to HIV PrEP services in Ukraine requires additional attention, including strengthening awareness raising component. So we have to focus that component of women, and telehealth HIV PrEP prescription and follow-up is a promising approach during war times and forced displacement of many Ukrainians. Thank you for your attention. And usually when, as Lina Kostenko says, when a person is part of a nation, then they are a human being. So that's relevant, I think. Thank you for your attention. If you have any questions, I'll be happy to answer. Thank you.
Diana, thank you so much for this interesting, important presentation. It brings hope that we really will be able to cover more women, to improve access to PrEP for women. And considering that in Ukraine we already have experience of using injectable long-acting cabotegravir as PrEP, so considering that how many women are on this type of PrEP among all the population that receive access to cabotegravir long action.
Світлано, дякую за таке запитання. Дійсно,
Thank you, Svetlana, for this question.
бачите, розширювати до
We have connection problems.
Не чути, Діано, треба ще
We don't hear you, Diana.
повторіть, якщо...
You will probably have to repeat it again.
Ще зараз все. Все зараз.
Well, maybe we will hear you now.
Підкажіть, будь ласка, чи зараз чути, так?
Can you hear me now? Yes, yes, but please repeat.
Щиро вдячна за поставлене
Dear Svetlana,
запитання.
thank you once again for this
Дякую за
wonderful
поставлене
question.
запитання. Дійсно, підтримую ідею того, що варто розширювати доступ жінок
Yes,
до
the
таких
idea is
жінок,
wonderful that we have to increase the access of women to cabotegravir. And no connection again.
На жаль, знов.
Unfortunately, once again, I didn't hear how much. I didn't hear the figures. Yes, Diana, if it's okay, can you please repeat if women get that, and if they do, what are the figures and volumes?
6. Вона написала.
Oh, she wrote
Діана,
in the chat 6. Thank you, Diana. Thank you that regardless of the problems, including connection problems, you are with us.
Я зрозуміла.
Yes, but we got it. Yes, yes, we do have problems with connections.
У нас лишилося скільки? 7 хвилин?
But considering that we have only 6 or 7 minutes to go, before the end of our webinar. Your presentation was wonderful. So as far as I understood, 6 women received access to long-acting cabotegravir for PrEP. So I congratulate you with this start. Hopefully there'll be more women. Are there any more questions in chat? Right?
У нас є ще запитання
Yes,
в чаті. Чи
we have a
були
question in
випадки
our chat
інфікування
whether
ВІЛ
there
серед
were
пацієнтів,
cases of
що були
HIV
щеплення
infection
на
among
каботегравірі
male or
тривалої дії,
female
та які
patients
були
on
причини,
long-acting
якщо відповідь є?
cabotegravir, and if yes, what were the reasons for HIV infection? Why it happened?
Пані Діано, якщо
Ms. Diana,
є можливість.
if you have this opportunity to answer.
Проблеми зі зв'язком.
Problems with connection problems. We don't hear anything, unfortunately. We don't hear anything. So let us do this way.
Я думаю, що нам вже треба
I
завершувати.
think that anyways we need to complete our meeting today, but we hopefully will get answers from Diana. And I don't think it's hundreds or more, because all in all we have 200 cabotegravir courses. It might be 0 or 1 person of infection, but when we have this opportunity, we will provide this information, this answer to this question in future. All right? Of course. And hopefully that now we are going to do this summary. In general, cabotegravir, long-acting cabotegravir, is not here for a long time, less than a year. We've been having it less than a year. Maybe it's going to be a separate discussion sometime about that. So thank you once again, Diana. Since, yes, August 15, 2024. Yeah, less than a year. But still, I think this is going to be a separate discussion that we are still to hold in future. So, dear colleagues, we are done. As usual, we just have 4 minutes to go. Sorry, Sergey. Thank you, Ms. Svetlana. Thank you. That's true. We have a couple of questions, but we will address them to our colleagues for sure after our today's meeting is complete, is over. So we are very ideal in terms of timekeeping. So 5 minutes till the end of the webinar, just to hear from every participant or every speaker of our today's meeting. So maybe I will start, will be the first. I'll just remind you that tomorrow we will meet again and we'll be talking about breastfeeding and chest feeding. And tomorrow I'm also going to be among professional, wonderful women, same time. We start same time, and after you register, you'll be able to join. And after tomorrow's webinar, you will have to fill out the survey to evaluate our webinar and to get the certificate. And now I am giving the floor to all the speakers' final remarks, comments, wishes. So Sylvia wrote, thank you.
Thank you very much. Thank you very much.
Дякую, Сильвія.
Thank you, Sylvia. Yeah, thank you, Sylvia, very much to you as well. Okay, then I suggest, who would like to say?
Yeah, thank
Caroline?
you for this wonderful webinar. It was really so great talks, 4 of them, and different topics, but they're closing up very well. And I think we learned a lot. I learned a lot from different perspectives to see a topic which is still not, I think there's still a lot to do. And I thank all the speakers, and especially I thank again Svetlana and Sergey, and thank you for being so active. I think we have to get on like this. Thank you, and really warm regards to everybody.
Дякую,
Дуже
дуже
вам
дякую.
дякую, Caroline. Хочу
Thank
сказати,
you,
що
Caroline. And
для
I
нас
would
саме
like to
найголовніше
say
є наша
that for
атмосфера.
us, the most
От
important
атмосфера,
thing
мені
is our
здається, що так, ми
atmosphere,
поділимося думками, досвідом.
because
Для нас дуже
we
важливим є
exchange
досвід
our opinions,
європейських
ideas,
людей,
and
різних
experience
європейських
for us.
позицій. І
Experience from
дуже
European
важливою
colleagues,
є наша
professionals is really
тепла
important.
атмосфера,
And also
яка
our warm and
наповнена
friendly atmosphere is really important to all of us, filled with love.
Дякую. Дякую, пані
Thank
Світлано.
you.
Пані Тетяно, декілька слів
Thank you,
нашим
Ms. Svetlana.
глядачам.
Ms. Tetiana, a couple of words from
З
you.
свого боку теж хочу щиро подякувати за таку можливість.
Yes,
Це
I
надзвичайно
would like
спілкування,
to
обмін
thank for this
думками,
opportunity,
досвідом.
for this
І
ability,
чудово, що є
opportunity
такий важкий
to
час.
communicate,
Дякую за
exchange
організацію,
opinions
за
regardless of the difficult
Світлану,
times.
Сергію,
Thank you for the
Caroline,
organization,
Сільвію,
Wave,
Тетяна, Олена,
Svetlana,
Наталя. Всім дуже
Sergey,
дякую.
Caroline,
І
Diana, Olena,
хочу ще раз
Sylvia. Thank you all.
підкреслити
And
інформацію,
just
яку
to
надала Тетя,
emphasize again the
що,
information
будь
that I
ласка, для
presented in my
українських
presentation
лікарів
at the end,
доступ,
for
вільна
Ukrainian
реєстрація,
doctors, there is free access,
бути
free
членом ІАКС, користуватися
registration
всім
to become
правами,
EACS
інформацією,
member, to
яка
use all the
відповідно
benefits,
надається
use all the
нашою спільнотою,
information provided
дружньою
by
спільнотою.
our
Як бачимо,
friendly
як в Україні, так і
community.
в Європі.
So we
Спільнота
can see
лікарів
both in
спеціалістів
Ukraine
питань
and Europe
лікування
the
профілактики
community
ВІЛ-інфекції.
of
Вона
everyone
дуже
who is
важлива,
involved
дуже
into
дружна,
HIV
дуже достойна.
prevention
Тому всіх запрошую.
treatment is
Єдине, що
always very
якщо що
friendly.
стосується чи
So
процедур, чи
welcome
ще не
everyone.
зрозуміло, можете
If
звертатися
you
або
don't
до
understand
секретаріату, або
anything,
написати
something
мені,
about the
я буду
procedures or
допомагати.
anything, ask the
Щиро дякую за
secretariat or me
можливість
personally. I will help you. So thank you once again for this
Саме
atmosphere.
конструктивно,
See
неважливо.
if we
До
are right
зустрічі
on time.
завтра.
We love you
Ми
all
з
and
Богом завжди.
see you
Завжди.
tomorrow. And we love you all, always.
Так, шановні колеги, ще раз дуже
Right,
дякую
dear
за
colleagues,
вашу
once again,
інформацію.
thank you very much. See you tomorrow. Goodbye.